Okay, thank you. We examined actions that PEPFAR has taken regarding the ARV drug supply chains, as well as partner country ARV drug supply chain operations. Regarding the actions that PEPFAR has taken, if you look at the diagram there, PEPFAR has taken a number of actions, particularly to assist with the procurement process. And then I'll also be talking a little bit about some actions that PEPFAR has taken regarding that entire supply chain circle. PEPFAR has done several things to strengthen ARV drug supply chains. PEPFAR has consolidated supply chains. For example, the Partnership for Supply Chain Management was contracted to form SCMS, the Supply Chain Management System, in 2005, which consolidated supply chains across 20 countries. In addition, USAID has taken initial steps to consolidate supply chains for PEPFAR with USAID's other global health programs to reduce management time and operating costs. Those other global health programs are the President's Malaria Initiative, reproductive health programs, and also the pandemic response. PEPFAR has also improved donor coordination for procurement through several mechanisms. One is information sharing. In 2006, PEPFAR, together with the Global Fund and the World Bank, and now joined by other organizations, other entities, has created a mechanism for information sharing that addresses ARV supply chain weaknesses. The donors get together, they hold regular meetings, alerting each other to potential supply crises and sharing best practices. PEPFAR also created an emergency procurement mechanism in 2010. This mechanism has approved funding requests for a number of countries, and in addition, it has helped nip potential supply crises in the bud without having to resort to the funding, to giving funding by moving up orders for procurement, expediting orders for ARV drugs. And finally, PEPFAR helps partner countries improve their supply chains through technical assistance, tools, and training. This covers all aspects of the supply chain. There are several supply chain assessment tools that are being used to identify problems and prioritize areas for improvement, and to assess internal controls and identify strengths and weaknesses. And some very specific technical assistance that we observed in the countries that we visited. One example would be in South Africa, where SCMS helped the South African government, cut in half the prices that it pays for ARV drugs. Turning now to supply chain operations in partner countries. Evaluations, we reviewed a number of evaluations of supply chains in 7 countries. We reviewed more than seven evaluations, but they covered, each evaluation covered one of 7 countries. And these evaluations cited weaknesses in inventory controls and record keeping. For example, in Zambia, an evaluation team identified ARV drug losses totaling about 265,000, or nearly 9% by value of the total ARV drug stock at the facilities the team visited. In another example, an evaluation in Mozambique indicated that the facility-level pharmacies had no monitoring or reconciliation of ARVs once they left the storage shelf. The Mozambique evaluation also noted that recording of units dispensed wasn't always standardized. Sometimes they were recorded as pills, sometimes as bottles. This has several risks. One is not knowing whether the drugs have been dispensed to patients, distributed to other sites, or lost. And harking back to the questions that were asked at the end of Todd and Brian's presentation, this is data that you need for decision making. Another risk is, again, data needed for decision making. It's hard to know what to order because you don't know what's been consumed. In addition, half of the evaluations we reviewed, as well as about a third of the PEPFAR country operational plans from fiscal year 2012 that we also reviewed, cited human resource constraints as contributing to weaknesses in inventory controls and record keeping at either treatment facilities or storage sites or both. For example, heavy workload, inadequate training, insufficient oversight may lead to poor, poor supply chain management. And poor compensation and working conditions may have led to absenteeism, turnover, pilferage, and poor performance by staff responsible for managing drug inventory. In at least one country, fear of shortages may have also led to hoarding of drugs. And the tools and training discussed earlier are helping address these weaknesses, but the process will take time. Finally, OGAC doesn't require country teams to develop plans or track progress made in measuring ARV drug consumption, waste, or loss. We reviewed country operational plans for the 7 countries that were covered by the supply chain evaluations. And we found that most discussed plans for addressing shortages and using consumption data to do so, but only a few addressed the risks of either waste or loss. We therefore recommended that OGAC develop and implement plans to help partner countries improve inventory controls and record keeping and track progress that partner countries are making in measuring ARV drug consumption, waste, and loss. And I'd be happy to answer any questions.